that's not Stephen's office.
No, it's not his
That's not
office.
his
And
office.
from that point on, everybody came to me and said, Isabel, you see how good he is that he came and said, thank you for just that. You know, he showed up, he said thank you, he had, you know, the thank you very much, the scheduler, the case manager, everybody. And that makes a difference. Your reputation changes in Miami.
Thanks, Steven. Now I have
Now she has to find another one.
This person calls me every day, and she comes back and she never says no. And that hurts. That hurts because you really don't. I know that you guys hustle a lot outside, and you know how painful it is for us. And we get the referrals, and we cannot stop the referral because people go to another agency or whatever happens. And then we feel that pain because I want to grow my census too. But at least recognize that from the start, from the office. You know, we were really hard and we tried to do our best. So we need to work as a team. That's the only way we are going to accomplish to grow this company and to do things.
Amen. Get the ED and schema the ED. That's what she's saying. Schema the ED, not the anything.
What is it?
Starting out, I was wondering if there's any advice you can give to an AE who's just starting out, kind of where to start to get the ball rolling, you know, to have that confidence to go in and get to grow the market and do what you got to do to help yourself and help the team and everything like that.
The biggest advice I can give to a new AE is to co-market, especially if you're new to a market. The biggest thing you can do is find other reps that are successful. Market with them because they've been in the market for a long time and they can open a lot of doors for you.
Where'd you come from?
I'm in Tampa office in this guy.
Oh, what'd you do before?
I was at retail, I ran a couple sporting goods
Oh,
stores,
okay.
so nothing like this.
Another good place to look is Target Watch
Okay.
in Playmaker. They've got a lot of great detail of referral patterns from physicians. It'll even tell you which agencies they referred to, what percentage they referred to them in the past, their Medicare volume in their office, how often they're making home health referrals, and it has the same information for your hospitals, which is really incredible.
You'll learn about that.
Yeah,
next
you're
week.
gonna have this in your hand next week.
Hey, yeah, print out your DRR.
That's
Have
the next
your
step.
ED, print out the DRR.
Okay, he doesn't know what that is either.
The referral log. Have them print out the referral log and go back and see where the business is coming from before, and then go to it.
You're gonna get a list of all the accounts that the rep was there before you.
That's really not up for that.
Where they've
Trust
all
me.
been. So now you have somewhere to go, and they'll tell you which accounts have given us in the past. So that also helps.
What my advice would be is to start working weekends. And really, there's no competition out on weekends. You go in there on a weekend, you're not going to see any home health reps. We've seen it firsthand with Alexandra in the Broward office. She's been with us, I think, 2 months. She goes out 3 or 4 weekends a month, every single weekend.
Holidays, Christmas.
And she gets,
Back to the hospital.
but she's getting dings from those hospitals she's going out to. Not so much nursing homes, because a lot of times nursing homes discharges, the social worker does on Friday, so it's done until Monday. But the hospital case managers, a lot of them will only have 2 nurses in there doing discharges for the whole hospital. Like Sharon said, you show up with pizza or bagels or donuts, and just let them know you're available.
Just show up.
And just show up.
Just
And
show up.
Nobody else
You'll
will
need
be.
So
So I mean,
else is there.
Yeah, I have
Show up and say, I'm here for you, use me.
When I first started,
Tell
like
me
a
what I
while
should know.
back, and it was very hard for me to penetrate the offices, and I had lots of window witches. All of them were window witches. What I did was, like, I focused sometimes on if I could get through a doctor, usually it was a luncheon, that'd be the only way to get in the back of the office. And you try to relate to that doctor as much as you can, and then just ask that doctor if he has any other doctors that you think that might, have patients for home health. And then you can use his name. I mean, sometimes a doctor will get mad if you do that, but a lot of times they won't. They'll be like, yeah, go see my friend this, and go see my friend Dr. So-and-so. So I used to write doctor's names of a specific doctor, and then I would use that. I'd be like, Dr. So-and-so said I should stop by and tell you that we can do home health, and you know, so it was like not a cold call, it was kind of like more of a warm call because I had a name. Just using that doctor's name. I have doctors that help me today that have never given me a patient. But just by me using that doctor's name, I've gotten business. So, and focus on I mean, your territory might be huge. When you're so green like you are right now, I just found this is your like first day. So it's like when I was being like that, I remember I thought I was so lost, thrown into the wolves with all these rejections. So what helped me was to be relatable. I always say at the end of the day, this is relationship selling. So for you, whatever it is that your hobbies, whatever it is that you like, try to see wherever you're from originally or where you were born. Bring that up in conversation and try to ask questions to see maybe somebody in the office was born in Iowa, like you, for example. It's just, you know, be relatable, and then that would get you in the door easier too.
Thank you, Audrey.
Your questions in the front, Sharon.
Oh, yes, sir.
So, my question goes back to being new, and that is, you're going to run into a lot of closed doors initially. And so I have one particular hospital, it's a closed system. I've been working on it for 4 months. Can you give me an example of a hospital that you guys have worked on and worked on and worked on, and what has worked for you as far as penetrating the hospital?
Have you been there on the weekend yet? No what?
You can't.
Go to the ER.
Yeah,
Go to the ER.
Absolutely, you are.
Go to the
Yeah.
ER.
But sometimes I see what you're saying. Sometimes
Sure,
you're
yeah.
blocked at right there with that guard that says, "What patient are you here to
Right.
see?" And that's as far as you go. Like I have hospitals like that, so there's like no.
So you go-
ERs.
We haven't even had a patient on a hospital list in that hospital yet, so.
Yeah, it's
Something that works.
Make sure you go to the first one with balloons.
Oh, yeah, absolutely.
you get well.
Something that works well physically, they won't let you in there.
Yeah.
They see you walking in, they got you. Call. Call them and, this is Mike, I'm here to follow up with case management on the 5th floor. Can you please put me through? See if they did.
Yeah, it's a luck thing. They might be like, all right,
And yeah,
it depends
keep
what
trying.
you get sometimes.
And they may put you through via the phone, and you get that case manager just for a second.
Yeah.
I'm Mike Bibby with Total Home Health. We just published our heart failure outcomes for Q4. I wanted to make sure they got to your hands. Can I meet you and see if you can get them to allow you up on the floor that way? That may be a window you can crawl through.
Or you could lie and say you were trying to get the director or case manager, and sometimes they'll shoot you to them.
No, and I've been up to the case management office a couple of times.
You can't schedule anything?
Or you can just
You have
say, I'm here
active
to see Mike
patients?
Smith.
Well, now also, I want to preface this because this hospital has their own home health as well, but they do not service patients outside
Do you
of
market their home
a
health?
certain area.
Yeah.
I just started
Oh,
working
yeah,
on that this
that's
week.
Market their
so-
home
And
health
another
for
way you can
coverage.
go is the POB. Every hospital normally has a professional office building next to it. And you
Yeah.
can't get through the hospital and you can't get to the case managers, get to the doctors. You can physically go into, most of these doctors have offices, urologists, cardiologists, pulmonologists, internal med doctors.
Yeah.
Get the referrals through them, because how it goes is patient choice, doctor's choice, and then no one has a choice, case manager's choice.
Yeah.
So you can always go that route, and also, like I have a big hospital in the medical center that they have a preferred home health list. We're not on that list, so you gotta go to different departments. Like they said, ER, if they have any pulmonologist clinics or cardiologist clinics, you go to those separate clinics and you try to find out who's the social worker there or who's the referring person there.
Clinics within the hospital.
Clinics within the hospital, because a lot of times we just focus on case manager, but there's
Yeah.
so many ways to get into that hospital.
Yeah, also, someone else has a relationship with those docs.
Co-marketing.
Some infusion company, some
You know,
DME, some something.
In the old, oh, sorry.
I was gonna say also, what's the name of the home health that is affiliated?
It's Christus.
Okay, so
Christus Santa
Christus,
Rosa.
all right. I can promise you in that professional office building that's adjacent to it,
Mhm.
every one of those referral people in that office building does not like using Christus. Because they're forced to use them for whatever other reason.
Yeah.
All they ever hear is you have to refer, you have to refer.
Well, I have a PCP.
They wanna
He's-
use somebody
He's
else.
wrote for me, he rounds in the hospital. He's wrote for me in the hospital, and he complains to me because their discharge planners will override
They do.
their hospitals, or their hospital list.
I always say it's case
And
manager's
send it.
choice first.
Yeah.
They really technically, they're the main decision.
So, we've been working on a way to get me in there. My last conversation was had to have him text me when he does have a patient, so that way I can just go up onto the floor and see the patient and discuss it with them before it goes to discharge planning or case management. So, but I've been beating my head on this stone wall for the last 4 months, and it's just very frustrating going back week after week after week after week, and, you know,
Mike,
delivering.
let me give you 2 suggestions.
I totally know how.
Yeah, sure.
Let me have the mic, I'll give it to Joe. We have, you know, again, we have a similar issue in some of our newer markets in Stewart and Port St. Lucie,
Sure.
where people don't know who Total is, and, you know, we don't know anybody in these hospitals. So the first thing we want to do is find out who knows people in these hospitals. And the first person who knows them is the outside marketing rep for the SNPs in the area. They are there on a regular basis. They know these case managers. So go to your SNPs, find out who their outside marketers are, become their friends. They might even be taking some of these case managers out for socials.
Yeah.
Okay? The other thing that we've done, and we just did it recently with Heather in St. Lucie, Port St. Lucie, is case management doesn't want to talk to us. They don't want us to come in. We've done what you did. We go to the front door, we ask for case management, they call the office, the response comes back, leave your information at the desk. Okay? So what did we do? We said, let's go hit the hospitalist group. They're not case management, but they write home health orders. So what we ended up doing was we set up a CHF in-service with the hospitalist group, who in turn, during that presentation, invited case management. And a couple of the case managers showed up. So this is how you go around trying, you know, circumventing the stone wall, as you call it, that
Sure.
you encounter.
Sure.
So that's what I would recommend.
Well, I figure it's a frustration that I've run into. I'm sure that some of the newer reps are going to run into it as well.
But just, you know, again, with the SNFs, just remember that that marketing person, they rely on that hospital for their revenue stream. So they have to know those case management people really well.
Yeah.
So get to know them if you don't already.
Well, one of the things I'm sorry. Please go ahead, please.
No, I need to go break.
So one of the things I ran into with this particular hospital is because it's surrounded by 7 or 8 SNFs, one of them being Warm Springs. And so because they have their own home health, Warm Springs, when they're discharging patients that have been sent to their rehab from Christus, they actually track their discharges back to the home health side on the Christus. So the only way I've been able to make leeway there has just been pitching areas that we service outside of the Christus home health service area. Now I haven't really had a referral yet, but you know that they're just so interconnected. It just seems like there's
all 7 rehabs can't be connected though.
no,
so you
not
gotta-
all 7. I'm just the largest one, obviously, being Warm Springs.
The other 6 I would target.
Yeah.
So, at least.
And then the other thing too, Joe, which another way to get in some of these closed hospitals is through the cafeteria. They all have to have lunch. If you can't get up there on the floors, you're more than welcome. It's a public hospital. You can go have lunch in there. And we used to sit with them all the time, right, Joe?
So this section of our conference today was really important to me because it's got, number one, your mind, your wheels turning, right? You're trying to come up with some questions, things that you run into, and now you've also had the opportunity not only to talk to, but to see face-to-face some of the experts in this company, and they're experts in the field, just like you're in the field. So you've got their numbers, you've got their emails. You're not going to be able to ask and answer every question today that you may have because we don't have that amount of time. So we're going to close this section now. We're going to give you a break, and then we'll return back in here in 15 minutes. We're a little off schedule, but we'll make it up. Thank you. Thank you so much, you fabulous people.
Roll beer, Dave.